How did a big cosmopolitan city like Bengaluru with over 1.2 crore residents manage to keep its COVID infection count to only 385? And out of Bengaluru's 385 cases, 237 have recovered and only 136 people are under treatment for the virus. In comparison, Chennai has over 15,000 cases, New Delhi has over 20,000 and Mumbai has over 40,000 cases. So what is working for Bengaluru while other big cities have been failing to stop COVID-19? Bengaluru reported its first COVID-19 case on 8th March. In the days that followed, Karnataka's health department along with the BBMP prepared a list of about 3,000 people who had come in contact with the 40-year-old techie who had arrived from the US. For over a month, these primary and secondary contacts were sent into home quarantine and were monitored for symptoms. A combination of technology and physical surveillance helped enforce strict enforcement of home quarantine. When officials visited homes of international travelers, they would not only plaster pamphlets but also inform neighbors, who then became part of the vigilance and reducing the burden on the already stretched resources of the government. And since multiple districts were involved in the process of contact tracing, bureaucratic processes had led to delays initially. So to resolve the matter, the state launched an app. Whenever a new case was reported and the patient shared contact details, the details were fed into this app. Since the information was available online, respective officials were alerted directly and instantly for tracking. Apart from being vigilant from day one, testing the right people helped the state to keep a check on the spread of COVID-19. On 15th April, Karnataka decided to test all persons suffering from influenza and severe acute respiratory illness. To help identify cases, the health department asked all medical stores to take the details of those buying medicines for these specific ailments. The announcement came hours after the state reported a COVID-19 related death. The victim, a 65-year-old male, was suffering from chronic obstructive pulmonary disease. Similarly, the state also reported a case where a 1-year-old toddler with influenza-like illness was tested positive. Now, another reason for some big cities to lose control over the COVID-19 situation was the inability to control clusters like Dharavi in Mumbai, Coimbatore Market in Chennai, and the Tablighi Jamaat conference in Delhi. But Bengaluru was able to control its containment zones more efficiently. The decision to seal Padarayanapura and Bapuji Nagar with around 40,000 people on 10th April may have set a template that saved the city from the rapid spread of the coronavirus. A similar pattern was followed in managing COVID-19 clusters such as Hongasandra, Mangamanapalya and Shivaji Nagar, where civic authorities and medical workers teamed up to contain the transmission of the virus. Apart from effectively sealing off containment zones, Bengaluru had one of the most strictly implemented lockdowns. Blocking off almost 50% of the main roads across the city, heavy police presence at hundreds of checkposts, and largely compliant residents greatly aided the efforts of frontline workers.